Hello, I'm Dr. Raynard Washington, and I have the privilege of serving as Mecklenburg County's Public Health Director. I'm a native of Richmond, Virginia, and it's been really great and a privilege to call Charlotte home for the last 3 years. Let me first thank the Social Justice Ministry and the entire Friendship Missionary Baptist Church team for hosting such an important event and inviting me back this year. As some of you may know, I'm an epidemiologist, which after living through a global pandemic, I'm sure everyone now knows what epidemiology is and why it's so important. At its core, it's a commitment to understanding how to prevent illness and death and how to promote good health for everybody. We do this through a variety of methods of prevention and individual and community-wide interventions to improve health in our community. Here at Mecklenburg County Public Health, that is precisely our mission: to protect our community from illness, to promote good health for all, and focus on how we create opportunities for everyone to be healthy and to thrive. It's probably no surprise to anyone listening today that health is not equally attainable for all of our residents, and that's the core of what we work to address. The realities of social and economic factors that unfortunately either propel people or limit their ability to be healthy continue to drive many of the gaps that we see in health in our community today. These disparities are not only in physical health, but also in mental health status, and that's really important for us to focus on. Before I go too far into some of the stats that I've prepared for today, I think it's really important to note that we all, especially as my grandmother would say, if you live long enough, we all experience mental stress and distress at some point in life. Acknowledging that you're not okay in your mind or your mind is not well, it's not just for people who have a clinical diagnosis or maybe getting treatment. All of us are vulnerable to mental illness, no different than our physical health. We've got to be intentional about maintaining good mental well-being. This might involve seeking help or taking advantage of other tools to help manage everyday stress of life, and simply, that's okay. So here are a few quick facts about mental health and how it impacts Mecklenburg County residents. Nearly 1 in 5 adults report experiencing depressive symptoms or having been diagnosed with depression in Mecklenburg County. That number is closer to 1 in 4 for women, which I caution us to overinterpret because that may be related more to the fact that women are more likely to seek treatment compared to men, particularly for mental health conditions. Rates of depression don't vary dramatically by race, particularly if we control for income. However, if we look at income, individuals in the lowest income groups are twice as likely to experience mental distress or depression compared to individuals in the highest income group. In the Black community specifically, rates of diagnosed mental health conditions are actually lower than the overall community overall. But again, I caution that may be in part driven by lack of access or engagement with healthcare, and of course, the long-time stigma associated with having a mental health condition, specifically in our community. Suicide rates overall have remained fairly stable in Mecklenburg County over the last decade, with roughly 10 completed suicides per 100,000 residents occurring each year. Suicide rates overall have historically been lower in the Black and African American community compared to the white residents. However, it's really important to note that men, especially Black men, do disproportionately make up the number of people who are completing suicide in the county. In recent years, we've also seen an uptick in suicide among really young people, which is heartbreaking. This appears to disproportionately impact very young Black children, and recent data from the Behavioral Risk Factor Survey suggests that people ages 18 to 24 are increasing the number of folks who are experiencing suicidal thoughts or ideation. Of course, suicide is a more extreme outcome of experiencing mental health conditions. Importantly, people who are experiencing mental illness, especially when it's untreated, are also more likely to engage in unhealthy behaviors as coping mechanisms. This could include things like binge drinking or smoking cigarettes or marijuana, illicit drug use, or prescription pain abuse. These outcomes can be incredibly detrimental to physical health and an individual's ability to overcome social and economic challenges. So to my last statistic for today, it's estimated that only 1 in 3 African Americans with a mental illness receive treatment. That means that 2 out of 3 people of us, specifically African Americans who need care, either have not been diagnosed, not treated, or are at risk of severe complications due to their condition. Closing this gap or getting people the care they deserve and need is the most important thing we can all do to address the mental health crisis we're experiencing. I say we all because we all have a role to play. It's important for us to, in this discussion today, unpack why people are not receiving the care they need and deserve. And the first reason, of course, is access. Care is not universally accessible, meaning there are not providers readily available to everyone, easy enough to find, and most importantly, not affordable, especially if you don't have health insurance. This is a reality, not having insurance, that unfortunately too many people in our community, our residents, face. And we all have a voice in the matter. So I encourage you to use your voice to advocate for those who cannot advocate for themselves. We must ensure that policies and budgets are implemented that make healthcare more affordable and expand access to everyone. Thankfully, in Mecklenburg County, we have a number of initiatives that are focused on making care more accessible, including our annual investments in primary care access for folks who don't have healthcare insurance, low cost and free behavioral health services that are available through the MEC Hope Initiative. And recently, we've embedded a behavioral health provider in our Community Resource Center who is available for treatment on Freedom Drive at no cost. Secondly, it's important to acknowledge the stigma associated with mental health, especially in the Black community. We have to talk about mental health and mental illness and talk about it differently. We must be inclusive in our language, non-judgmental, and most importantly, compassionate. As I mentioned earlier, mental illness isn't some miswiring that only some people experience. We all are at risk, given the tests and trials and trauma of life, for experiencing mental distress. And we must normalize how we talk about it because it could impact any of us. And us normalizing how we talk about it will help people embrace treatment and therapy and not shy away from it because of fear of being stigmatized. This is particularly true when it comes to suicide. I've heard so many times that suicide is not a Black thing. The truth is, it has no color, and not talking about it does not make it a reality for our community. I myself am a survivor of suicide. I lost my father to suicide about 8 years ago. It was one of the most difficult seasons of my own life, but I sought help, committed to talking about it, raising awareness about it, and not hiding it as many of us do. Lastly, I'll mention another key piece of the equation, and that is the mental health providers. We have to continue to work on increasing our supply of providers, specifically Black and brown providers. We need providers who can deliver care in a way that is sensitive and appropriate for individuals' culture. And while it's impossible to just spring up a bunch of culturally competent providers overnight, I know that's not the case, we can start to move our youth and others into careers that involve mental health treatment and behavioral health care. And we have other critical partners available to us today that can work to help fill some of the gap. And that includes the church and other houses of worship. I am so thankful to Friendship for taking a leadership role in this space and continuing to center mental health in your social justice work. Houses of worship are places of healing for those who are experiencing mental distress and trauma. And in the near future, I'm very excited to share more about an initiative called Soul Shop that we'll be bringing here to Charlotte, which will work with pastors and faith leaders to increase their capacity to address suicide in our community, in their churches, among their parishioners as well. So in closing, I am Dr. Raynard Washington with Mecklenburg County Health Department. I am passionate about social justice when it comes to equity for everyone to have an equal opportunity to live a long, thriving life. Thank you all again.